Today's topic is popliteal fossa. Popliteal fossa is a hollow depression, diamond-shaped hollow fossa or compartment that is located at the back of the knee in the lower limb. It has boundaries and contents. The boundaries include posterior, anterior, which are also called roof and floor, a supralateral and supromedial boundary, and a inframedial and infralateral boundaries. Then we have contents. So let's see these boundaries one by one. We have roof, which is also called a posterior boundary. So the roof is formed from outward to inward by the skin, superficial fascia, deep fascia, which is also called in this region as fascia lata. And this fascia lata, as well as the superficial fascia, is pierced by the small saphenous vein and posterior cutaneous nerve of thigh. Then we have floor. The floor needs to be described from above downwards, that is, from proximal to distal structures, or starting from femur above up till tibia below. So we have popliteal surface of the femur. Then we have in the center the knee joint capsule, its posterior aspect. This capsule of knee joint is reinforced by a ligament which is called oblique popliteal ligament. And this ligament itself is pierced by the genicular nerve and genicular vessels, which are going inside the joint cavity to supply the knee joint. And then we have a popliteus muscle along with its popliteal fascial covering. So this is the floor or the anterior boundary of the popliteal fossa. Then superiorly and inferiorly on the medial and lateral aspects. Superiorly and medially, we have semi-tendinosus as well as semi-membranosus. So we have semi-tendinosus as well as semi-membranosus. Semi-membranosus is more medially located as compared to semi-tendinosus, which is more laterally located. Then we have biceps femoris that forms the supralateral boundary of the popliteal fossa. Inferiorly on the medial side, we have the muscles of the leg. The superficial among them is called gastrocnemius. It has two heads, a medial head, which actually forms the inframedial boundary, and a lateral head, which is forming the infralateral boundary of the popliteal fossa, along with the plantaris muscle. So the contents of the popliteal fossa, they can be divided into arteries, veins, nerves, and miscellaneous structures. So in the arteries, we have popliteal artery, along with its two sural branches and 5 genicular branches, as well as muscular branches that are given off to the muscles forming the boundary, inferior boundary especially, of the popliteal fossa. Veins include the popliteal vein and its tributaries, also the terminal part of small saphenous vein. In the nerves, we have tibial nerve along with its motor branches, then sural nerve, which is a branch of tibial nerve. Next to it, we have common peroneal, also called common fibular nerve, along with its branches, which include the sural communicating branch and the lateral cutaneous nerve of the calf or leg. And further, we have superior and inferior genicular nerves along with recurrent genicular nerves, all of these being branches arising from common peroneal or fibular nerve, which is itself a component of the sciatic nerve along with the tibial nerve. Then we have posterior cutaneous nerve of thigh, and in the capsule, running along with the genicular arteries, we have genicular branch coming down from the posterior division of the obturator nerve to supply the knee joint. Then in the popliteal fossa, some miscellaneous structures in the form of popliteal lymph nodes and vessels and fat are also present. So this was all about the contents of the popliteal fossa. Next, we have to see relations of the contents with each other in the popliteal fossa. That is कि ये जो structures मौजूद हैं इस popliteal fossa में उनका आपस में एक दूसरे से क्या relation बनता है. This question is often given in the MCQs as well as in the draw and label question in the SAQs by the university exams. So for the understanding of the relations of different contents present in the popliteal fossa, we can divide the popliteal fossa into an upper part, middle part, lower part. Upper part, middle part, and lower part. So in the upper part, you can see that here in the yellow is shown the sciatic nerve being dividing into its two terminal branches at the apex of the popliteal fossa into tibial nerve and common fibular, also called common peroneal nerve. And then we have popliteal vein and popliteal artery, along with the lymph nodes and lymphatics and fibrofatty tissue. So usually the relation of these three structures, that is the division of the sciatic nerve and the popliteal vessels, is very important and commonly asked in the questions. So let's see. In the upper part, you can see that sciatic nerve is shown to be dividing into tibial nerve and common peroneal. Tibial nerve in the upper part lies lateral to popliteal vessels. Medial to tibial nerve, we have popliteal vein, and medial most structure is the popliteal artery. So in the upper part, if we start from the common peroneal nerve, which is being the lateral most structure in the upper part of popliteal fossa, next to it we have tibial nerve, further medial we have popliteal vein, and medial most we have the popliteal artery. Now let's move on to the center or middle part of the popliteal fossa. We can see that tibial nerve can be shown to be passing or crossing the popliteal vessels posteriorly from lateral to medial side. So in the center, the posterior most structure in the middle part of the popliteal fossa is tibial nerve. Further anterior to tibial nerve, we have popliteal vein, and deepest in the center, deepest or the anterior most structure in the center of the popliteal fossa is the popliteal artery. This is often asked in the MCQ that which of these three structures lies anteriorly or deepest in the middle part of the popliteal fossa. The answer is popliteal artery. Then further in the lower part of the popliteal fossa, you can see that after crossing posteriorly, tibial nerve has finally come to lie medial to the popliteal vessels within the lower part of the popliteal fossa. Then lateral to it, we have the popliteal vein, and lateral most structure is now the popliteal artery. So this is how you must understand and must be able to describe the relation of the different structures, especially this neurovasculature, in the different parts of the popliteal fossa. So I hope this topic is clear to all of you.